Let's bring in a medical scientist, Janet Olatunji, who joins us live from the United Kingdom. Janet, 980 dead today in UK hospitals in what has now been considered the deadliest day yet of the pandemic, taking the total figure where you are to almost 9,000. It does appear the curve is not flattening yet over there, right?
That's absolutely correct. And good evening to you, Ifemi. Yes, that is true. I mean, it's still early days, and initially we were thinking that the curve would be round the corner. But as things are at the moment, um, we are not quite sure when that will be. But yes, the death toll today was 980, and that's the highest so far.
So thankfully we hear that the Prime Minister is out of intensive care unit. I'm also glad that you specialize in humanitology and blood transfusion. You must have heard about the treatment that is now being tried in the United States, the use of plasma from patients that have recovered from the virus. How optimistic are you about this trial?
Well, yes, it's called Convalescent Plasma, and yes, I am indeed optimistic. This has been used before in 2001, I believe, when, for the treatment of SARS and MERS, and it was successful around that time. But at the moment, publications by the Proceedings of the National Academy of Science in the United Kingdom, in the United States, um, you know, there's an article that they published, which actually talks about this trial, which was done in China, and about 10 people were tested, and it was actually quite successful. So, I mean, this is an ongoing trial, and we're still waiting to see how that goes.
Earlier in the week, in one of our rare speeches, the Queen of England, who also doubles as the head of the Commonwealth, preached partnership amongst countries of the world to winning this particular war against the virus. Do you know if the UK, where you work, is in any way considering working with other parts of the country, especially as there are thoughts rife on social media that this is a biological war?
Well, biological war, there is no scientific evidence to support that. So I completely, you know, personally, I don't agree with that. But of course, we are complying with the social distancing and, of course, washing our hands and using PPE in hospitals and care homes. So, I mean, these are, stuff that needs to be done basically in order to curb the transfer of coronavirus. And I believe it's working, absolutely working. We're on lockdown now in the United Kingdom, and I believe that this is actually going to work, and there's an evidence of it working in other countries like Germany and even in Spain as well. So and of course in China as well. So I think it's very, very important for us to adhere to all the guidelines that the government and the WHO are prescribing.
Janet Olatunji is a medical scientist who specializes in humanitology and blood transfusion. She joins us live from the UK. Keep safe and thank you for talking to us tonight.